Welcome to this Tutor to You Sociology topic video looking at work, poverty and welfare, focusing on the impacts of austerity on poverty. In this series so far, we've looked at some of the impacts of government policy and how they've attempted to provide solutions to poverty in the UK. However, one of the biggest impacts on the levels of poverty has been argued to be the austerity policies of Conservative and coalition governments from 2010 to 2019. These were briefly interrupted by the COVID pandemic and increased social spending in 2020 and 2021. But the re-emergence of austerity, or Austerity 2.0 as it has been called in some quarters, in the years following has caused recent concern about the impacts of further austerity policies on poverty. Austerity is the term given to a range of policies that look to reduce social spending, particularly on welfare, in the aftermath of the 2008 global credit crisis and the election of a Conservative and Liberal Democrat coalition government in 2010. The then Chancellor George Osborne introduced these policies as the newly formed government looked to balance the books following state bailouts of banks and other private industries during the credit crisis. These policies have been argued to have had a negative impact on both the economy and the standard of living of those in the lower socioeconomic classes, with Professor Michael Marmo, author of the Marmo Review into Health Inequalities, stating that austerity caused up to 1 million early deaths because of poverty and cuts to welfare. In this video, we're going to look at some of the austerity policies and how they impacted on different social groups. The main purpose of austerity policies was to cut social spending to affordable levels and reduce government borrowing, but many different aspects of welfare were impacted by these cuts, including the cancellation of the school buildings programme brought in by the previous Labour government, which sought to address the decline of the condition of schools and an expansion in the number of children seeking places following the early century increase in the birth rate. Other cuts included the replacement of working and child tax credits with the new universal credit. This would also replace unemployment benefits such as job seekers allowance and the employment and support allowance, with the idea that the benefit system needed to be streamlined so individuals would receive one payment rather than scattered payments across the month. There were also significant cuts to disability benefits and the introduction of assessments for those claiming disability. These assessments were often conducted by untrained professionals, and targets were set to reduce the number of successful applicants by applying an objective scale to measure disability or impairment, rather than judging on a case-by-case basis. Housing benefit was also reduced for those who lived in a home with a spare room. The spare room supplement, or bedroom tax as it came to be known, disproportionately affected the disabled and those needing carers to stay overnight. Furthermore, a two-child benefit cap was introduced, meaning that larger families could only collect benefits for a maximum of 2 children, and a benefit cap of £25,000 was introduced that targeted these larger families with complex needs, meaning the maximum a family could claim was £25,000 in total, including all housing and unemployment benefits. While some argue that these policies were necessary in order to balance the books, recent research has highlighted that these policies, amongst others, hit the poorest families the hardest and increased poverty in the UK. The European Human Rights Commission in 2022 examined the impacts of austerity and found that these policies had created greater hardship amongst the bottom 11 to 40% of the population, who financially lost out more in benefits and support allowances than those in the top 10% did from cuts to services. In fact, many sociologists point to the expansion of earning and cuts to taxes that the top 10% received during this period and outline how austerity was a redistribution of wealth from the poorest to the richest in society, creating greater inequalities in the UK. Stuckler et al. Found that the impacts of these cuts and the real-term reduction to funding of education and the NHS negatively impacted on health outcomes, with the average life expectancy in the UK falling for the first time in over 50 years. That is, that people born in the late 2010s were expected to live shorter lives than those born in any generation since World War II. This was compounded by precarious employment, underemployment through zero-hour contracts, and higher unemployment, and saw an increase in the rise of poverty in the UK. The use of food banks, which we looked at an earlier video in this series on voluntary welfare, has increased to 3% of households according to conservative government estimates, with estimates of those in poverty varying from 10 to 14 million people in the UK today. The impacts of austerity were also compounded by the COVID pandemic and the sharp rise in the costs of living in the period thereafter. Recent estimates of child poverty sit at 4.2 million according to the Child Poverty Action Group, and the Joseph Rowntree Foundation in their annual report on poverty in the UK stated that over 1 million children live in a household with a disposable income, that is, money left over after the costs of housing and bills, of £85 a week. The current indicator for deep poverty is around £170 per week. Further impacts include the increased use of food banks, with almost 3,000 food banks in operation in the UK, many located in schools, and evidence of parents skipping the use of hygiene products simply to put enough food on the table. The impacts of austerity are severe for many children in poverty. The UN Commission on Human Rights, who looked at inequality in the UK, concluded that those with disabilities were also unfairly targeted by austerity. This report went as far to suggest that austerity policies infringed on the human rights of disabled people. This was echoed by Professor Michael Marmot in recent reports. Cuts to healthcare, benefits, housing and employment legislation have seen 4 million people with disabilities living below the poverty line, and this has increased significantly over the past decade. Austerity policies have impacted on levels of poverty, with those already in danger of increased poverty, children, large families and the disabled, the most likely victims of these policies. That concludes this Tutor to You Sociology topic video on the impacts of austerity on poverty. Thanks for watching.